Shalom, welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabad House of Delmar, together with my co-host Mark Warnich of Statewide News Service, jbiztechvalley.com, and now columnist for the Jewish Press.
Yeah, I have a column called Albany Beat, and it's an honor to be part of a nationwide weekly publication. So that's great. Now with us today, we have a special guest, Linda Weiss. She is the director of the Albany Stratton VA Medical Center, I guess is what you call it, or a hospital, or?
It's the Albany Stratton VA Medical Center.
Okay, I was right the first time.
Yes.
I should have stopped there. So welcome to the Jewish View.
Thank you. Thank you.
So how many people do you service at the VA hospital?
On an annual basis?
How many veterans?
About 42,000.
Okay.
Wow, that's a lot.
Well, we cover an area that to the south encompasses Kingston to the Canadian border, and we see veterans from southwestern Vermont, western Massachusetts, northwestern Connecticut, and parts of Pennsylvania, and then veterans who are referred to us for specialty services that another VA may not have.
How far west do you go? Does your catchment area?
We generally, around Utica, the catchment area switches to the Syracuse VA Medical Center, albeit if they don't offer a certain service, they come
So you have
over.
about 30% of the state in terms of counties, in terms of land size, in terms of, catchment area.
Yes,
Wow.
not necessarily 30% of the population.
No, but in terms of the catchment area and the geography, that's about 30%.
So anybody who went to the services for a few years has a full right for medical services the rest of their life at the VA?
Well, right now, any returning combat veteran has 5 years, no questions asked, eligibility.
For
and
what?
then
Eligibility for what?
for health care.
Okay.
And then there's a variety of different regulations that the Congress has passed that talk about your priority for access to services. Service-connected disabled veterans obviously are our highest priority, followed by a number of veterans for whom we are their primary health care provider because they don't have the resources for other types of health care.
Well, that's interesting because I was going to say I know a few Jewish people that go there, and it just he went through the Air Force. I mean, every service is a service, but it wasn't like he was in combat. Sometimes you think, okay, let's take care of our, someone was in combat, they lost a leg or they got shot, and of course we have to take care of them, but so I'm saying they take care of really a lot other.
A service-connected disability might be anything from the service person contracted cancer during their service time. They may have developed a mental health disorder. They may have been exposed to a communicable disease. Some of what I call the silent veteran conditions, certainly those with traumatic brain injuries these days, may not be apparently obvious, but we also take care of a large number of veterans who financially cannot support private health care for themselves.
It's interesting. What about mental health? Because you always talk about that nowadays. It's a big issue. What's the
PTSD?
Yeah, thank you for the
Post-traumatic stress disorder.
I mean, that's a psychological idea, not. It gets medical also if they need medicine.
Well, when you take a look in the United States, 1 out of every 4 persons will experience a significant mental health issue during their lifetime.
Really? I never heard that number.
Yeah.
1 out of 4.
And veterans, veterans during their course of service may have been exposed to different incidents and traumatic events that makes it very difficult for them. Consequently, we have a very robust mental health program. What we call post-traumatic stress disorder is actually a problem that has been recognized long in the military. It may have been called combat fatigue or stress, shell shock during World War I, but it has been significantly recognized for many years. Post-traumatic stress disorder definitely is one of those issues many people experience, and they experience in different presentations and degree.
Mm-hmm. And you have a special relationship with the Jewish war veterans. I've been over at the VA hospital, not because I'm a veteran, but just for certain ceremonies, and you have a very special relationship with that post 105 and 106, I think, in Schenectady.
Well, a dear friend of mine, Miriam Jaffe, was a member of the Jewish War Veterans. Miriam's daughter and I had gone to elementary school together, so I had known her as a young girl.
Is her name Eleanor?
No,
Is
Beth.
the daughter
Oh,
Beth?
Beth,
Okay.
Elizabeth.
Oh.
And Miriam had served as a Navy pharmacy tech during World War II on a ship, and then came to work for the VA. So it was really getting reacquainted with an old friend.
Sure.
And she was incredibly wonderful. After she retired, she spent a significant amount of time volunteering. I got to know many members of the Post through her, and she was a wonderful support, very enthusiastic in terms of caring for other veterans, and really educating people about veterans and their contributions. So, you know, it's a really wonderful link to both my childhood and her, and the Post itself is wonderful. They sponsor the Four Chaplains Award in the ceremony every February, recognizing a leader in veterans issues in this region. They devote a lot of volunteer time to the hospital. One of their absolutely wonderful gifts to the veterans there, Christmas Eve, they come in and they have a Jingle Bell chorus that they come in and brighten the holidays for the veterans, so some of the other staff can go home and celebrate.
Is there menorah lighting also? Not just for Christmas, but maybe a menorah lighting for Hanukkah?
We actually haven't done that, but we do have a menorah as a symbol for the holiday to commemorate that.
Got it. Get on this.
All right.
Maybe you would allow a menorah lighting.
Absolutely.
Yeah, okay.
Absolutely.
Well, the Supreme Court said it's okay, so I guess it's okay.
You know, veterans, people tend to think of, characterize veterans. Veterans are 19 to 95.
Right.
They're tall, they're short, they're male, they're female in increasing numbers. Every religion under the sun, every ethnic mixing background.
Every color.
Absolutely.
Yeah.
You know, you say, I don't know how to even say it in the English, Mechutin, that Rabbi Zalmi, who works with me, his father-in-law, is actually a very, very big person in the VA on a federal level. He's a doctor, and he's like the #2 man. And he came from a different area of the country, not here, but he says, you know, there's a lot of problems with the VAs, but he said that Albany is really a pretty good one. I mean, they were saying that veterans have to wait in line, and you know, you hear these headlines, but
he's talking about the Arizona experience, I think. But I think, you know, when I came over and you were giving a talk about this, you know, you were citing some phenomenal numbers, and I don't know if that was, you know, hype or if that was, you know, objectivity or what, but I just would like for you to tell that again here for our audience, you know.
Well, first of all, we're completely transparent.
Yeah.
What we report is what we are. And as I say to the staff there, if it's bad, and we're going to admit to it and fix it. If it's good, we're going to talk about what's good and what we do well. There's always an opportunity to do a better job. Obviously, there have been VAs around the country who have not acquitted themselves well. I don't really want to spend a lot of time on those VAs.
No, we want to talk about our local VA. I mean, but you know, we're not on in Phoenix or in Arizona TV. So let's talk about the Albany experience.
Albany VA at 42,000 patients. We see about 450,000 outpatient visits a year, number of admissions, about $250 million budget a year.
That's it.
But one of the most, one of the most amazing pieces of that hospital is its staff. Now there's about 3,000 people who may make up the staff, but there's 1,300 full-time equivalent employees. And I have to tell you this, 1,299 of them make my job look easy. In the past 5 years, we've really taken on a journey to improve quality, make sure we have access. We have hired a number of medical staff and wonderful quality medical staff, first-rate nursing staff. We have a series of performance measures. Many of them are based on patient care clinical guidelines. So all the way from preventative measures, how many people have had their colonoscopy, gotten flu shots, all the way to other treatment modalities, how many patients receive their antibiotics timely around the time of surgery, had beta blockers in the immediate post-myocardial infarction period. And those measures are important to us because they talk about how well we deliver care to patients. Our access is high. Right now, we hover between 96 and 97% of all of our primary care is within a 14-day time frame. Specialty care can be a little more difficult depending on what the specialty care is. We actually recruited for 5 years before we got a dermatologist. They're very tough to hire. But we finally got one, came on board. It's been wonderful.
How many years? How long have you had the dermatologist?
He's been with us for about 6 months now. So this has been very terrific.
New. Okay.
We've expanded the number of gastroenterologists. We do robotic surgery. We're doing all sorts of interventional radiology work. So it's a very high-tech operation.
Everything is specialized now as in the medical field. You used to have a gastroenterologist was called something else back in the olden days of the 30s and 40s, and now if you have something wrong with your leg, there's a guy for just the ankle, a guy just for the calf, just for the knee, just for the left side of the knee, just for the right side of the knee, just for the big toe, just for the small toe. It's like very specialized with, and you need all those specialties.
Well, in orthopedics in particular, that field has really changed because of technology, both in terms of planning and assessment of joint surgery and the new high-tech joints. I mean, shoulder replacement surgery now is so common, and even a few years ago it wasn't. It was a little more unusual in this area.
Do you do surgeries at your hospital? Do you go to Albany Med to do surgeries?
We have a pretty robust surgical program, general, thoracic, urology, specialized GI.
How many OR rooms do you have?
We currently run 5 full operating rooms, and we have a 3-room endoscopy suite that we also run. And this is an area we're probably going to have to expand.
Let me ask you this question. I don't mean to get to be a troublemaker here, but has anyone ever faked saying that they were a veteran when they really weren't, just so they can get the medical care, and then you found out later that they really shouldn't have been there?
Yes. Now,
that's sort of a testament to how good your facility is, because if it wasn't good, people wouldn't want to be faking it to go to your facility.
Well, the government has a very clear process to vouch for who is a veteran and who's not. But we run a 24/7 emergency department, 24 hours a day, 7 days a week. And in all honesty, someone comes to our door in distress, we're going to treat them first and ask the questions later.
Okay.
We've also at various times have been the only facility in the area that's offered certain services. In my earlier days, I worked in medical imaging. And at one point, we had the only nuclear cardiology operation in town.
At the VA.
At the VA, and we were doing cardiac assessments in nuclear medicine, using nuclear medicine studies for 9-year-old kids.
And you had that before Albany Med?
Yes.
It's amazing. What year did you have what?
I would date myself. This is back in the 80s.
Well, how long have you been the director of the VA?
I've been the director of this VA Medical Center now for 5 years, but I just embarked on my 43rd year as a VA employee.
Wow.
Yeah.
And you're 45.
Nice try. I have a 45-year-old son, so that's a little dicey in that respect.
No, it does say on your resume that and your CV that you were born in 1953, so it's out there for the public. So
still 29. We'll
anything.
Get the arithmetic over here.
So.
With such a large catchment area, the other piece that we do have the fixed main medical center at the hospital. We have 11 large primary care practices that are all over our geographic area. So Kingston, Catskill, Troy and Schenectady, Glens Falls, Clifton Park, Plattsburgh, Saranac Lake. So there's a large number of those. So care is close by to the veteran. And then we have a fairly sophisticated telemedicine system. So the telemedicine carts are really wonderful. They're about $100,000 a piece, but they have a high-tech stethoscope. We have retinal imaging cameras to look at your retina for early diagnosis.
Through the phone.
It's through fiber optic lines.
Yeah.
So it's pretty impressive.
Amazing.
I talked to somebody who was into that industry and said that could be the wave of the future. Because like you say, someone's out in Saranac Lake, and schlep, as we say in Yiddish, for an hour for something. Doctor says, well, I could keep a beat on your diabetes or whatever, because you're saying, you go to the doctor, give me a blood test, give me diabetic, or just all the heart rate. A person had a heart attack. And they can do this, and save everybody a lot of time and money.
Right.
Well, for some veterans, it's not so much even the time, it's the fact that the transportation is a challenge, or their medical condition makes transportation a challenge. So if you're in Plattsburgh and we're seeing you at the general primary care practice, which by the way has mental health embedded in it as part of its services, but you need a pre-anesthesia, a pre-surgical anesthesia screening, we're doing those by telemedicine.
So you're giving new use for landlines? Or can you do this on your cell phone? Because you said fiber optic, so I'm just wondering if...
I have to tell you, I administer the system.
Oh, okay.
Exactly how it works, I'm
Because
not going to answer
I got
to.
rid of my landline, and if you're giving new use for landlines, I'm sure Verizon's going to love you.
Well, after 6 years, you're looking at a woman who just learned to use her DVR, so I'll pass on trying to explain how it works.
Okay, not a problem. Now that you solved your dermatology problem, dermatologist problem, do you have another specialty that you are finding tough to fill?
Well, our difficulty in attracting providers in a certain area usually mimics the local market. We're very fortunate. We just hired some wonderful orthopedists. We had several departures, retirements, and an illness, and consequently we had a gap. Now, when that happens, we do buy services in the community.
Yeah.
So, but I'm fully staffed in orthopedics. Geriatricians are very difficult to recruit.
Geriatric
specialists. There's just not that many people going into the
people
field.
Are getting old.
Well, bigger population, not that many docs going into that specialty. So that's been a challenge, and it's been a challenge overall. We are extremely fortunate in our community partners. We have a main academic affiliation with Albany Med. We work closely with them. Sometimes we do joint recruitment or sharing of staff. That works beautifully, especially if I need enough of a thoracic surgeon that I need half of one. It's tough to buy half of a thoracic surgeon. But it also allows us to jointly recruit. We have some capacity nationally to compete for research. Some of the providers and physicians are interested in that avenue, and it makes a joint recruit really pleasant to do.
When was the building built?
The building, they broke ground in the 1940s, and the building and I both debuted in 1953. So that
62 years.
It's
And
62
after World
years
War
old.
II, that there were so many probably veterans needed help.
Well,
1.2 million returning veterans who needed immediate medical care.
Really, that many?
A
in this
tremendous
area.
number.
No.
Nationally.
No, nationally.
All right. Let me ask you, what has been done with the facility over the years to update it and to keep, and because, even back then, the hallways were smaller, you need wider hallways now, you need wider doorways. I mean, I know with St. Peter's, when they had a medical imaging machine, they had to take it in through helicopter through the roof, because their facility wasn't set up right, for them to take it through doorways. So I'm just wondering, what do you have to do still to make it look more appealing because it looks like an older building, or maybe it's just fine the way it is and it doesn't need anything. I'm just asking. You know.
Well, we like to compare our exterior with our Art Deco partners along Holland Avenue there.
Okay, that's fine.
And
fair enough.
But a couple of different things. The hospital was originally built with 1,000 beds. Now, as a young woman, some of the wards were they were called bullpens. They were open bed wards of 21 people. You had a curtain between the beds. Right. What we've done is sequentially remodel inside the hospital. We're predominantly private rooms. So, we have broken up those large multi-bed rooms into private rooms. Obviously, we never started with CT or MRI. We didn't have to lift through with a helicopter, but we actually opened the side of the building to slide the equipment, the MRI and the CT in.
Wow.
So, over the years, we've done that kind of renovation, but we embarked, about 5 years ago when I went to the hospital, we really embarked on a focused planning to both co-locate services for patients to make it easier and also to predict the future. Mm-hmm. So for instance, we have a dialysis unit that currently has about 12 chairs in it, and it runs 3 shifts a day, 6 days a week. Mm-hmm. About a third of our patient population are diabetics. Mm. That tells you our preponderance of renal disease is going to be there. And I have a group of veterans that I pay for at private facilities to get their treatment there because I don't have enough beds. We are currently in the design process of taking an entire ward, gutting it, and redesigning it to expand dialysis.
Okay.
We have another ward, for instance, that we completely gutted. It's a state-of-the-art oncology infusion suite. So we do medical oncology. There are actually some additional buildings on campus on Myrtle Avenue. One is the radiation oncology building, so we do state-of-the-art radiation oncology. And we're one of 7 hospitals, 7 VAs nationwide that do prostate seed implants to treat prostate cancer. Yep, yeah. And we just built a new building adjacent to that, and that houses our PET, positron emission tomography scanner.
Tomography I got, but PET, what's PET?
Positron emission tomography.
Oh, PET, okay.
And actually looks at functional assessment of tissue, particularly valuable in staging cancers and staging injuries and changes within the brain and spinal cord. Wow. So pretty interesting. But it could not be supported in the main building. So we built a new building and also moved the nuclear medicine department there.
And where is that new building?
It's on the back side of the hospital on Myrtle Avenue.
Oh, it is? Okay.
Yeah.
How hard does it get funding? They're always saying the government is cheap, on different things. And, everybody wants a piece of the pie. But I'm just saying, this is like incredible money. I mean, are you at that level where you have to petition, hey, I want a nuclear facility, hello, give me another few $1 million.
And to follow up with Rabbi Simon, do you have a foundation? Are you allowed to have a foundation? Are you just federally funded only, or what's your financial status?
Well, there's a few things that go into that.
Yeah.
First of all, our predominance of our funding is federal funding.
Right.
Depending on the veteran, if they have some private health insurance, if it's not for their service-connected disability, and depending on income level, and there's a whole assessment formula, we may be able to bill some of their private insurance. Because if we're not billing their private insurance, the insurance company is collecting the premium but not having to pay anything. So we do bill insurance companies for a small portion of our revenue and income stream. We don't have a foundation per se, but we do have a wonderful voluntary service and program, and we actually have a number of very generous donations during the year.
Are you allowed to have a foundation being funded by the federal? Is there any prohibition from the federal government side that you can't do this private side? Or?
No, we do not. We do not support a private foundation of any sort.
But can you if you decided to?
No.
No, there's a prohibition from the federal government?
They're very strict about what types of organizations we evolve and are part of. So a private foundation is not one of them.
Okay.
So consequently, we do have a number of donations though every year, but it tends to go to either direct support of veterans.
Yeah.
So for instance, during the winter, some of our homeless veterans, it may go to clothing for them, because January can be very bitter without a warm jacket.
February too.
Yes. Some of it may go to things, we've had a couple of groups donate wonderful things like blanket warmers. You know, and the donations tend to be sometimes from a few dollars up to entire estates. It all goes into a general post fund, and that is strictly monitored as what can be bought and spent out of it.
And do you have to tell the federal government about this pot so that they know how to adjust their funding for the VA, or does it not impact the funding for the VA?
It's not large enough to impact funding for the hospital.
You wish it was? No? I'm just joking.
Can never tell.
No.
But any money that's donated to the hospital goes into a general post fund, which is part of the hospital accounting system.
Okay.
So it's well known to the government, it's
it
there.
Is. Okay, so what's your budget? What's the...
We run about, when all the different types of money are accounted for, it's about $250 million a year.
Right.
That includes some of our construction, sometimes specialty programs.
And are you allowed, when you do major constructions, are you allowed to bond that, and finance it?
Well, no, the government funds itself.
Okay.
We have to compete for any construction dollars.
Right.
I mean, we do get a smaller amount.
Compete to other VAs, you mean? Or?
With other VAs, yeah.
Well, I'll back up just a little. The very first thing we look at is who are our veterans and what do we think they're going to need, both in terms of age, disease, upcoming medical technology that we want to have for them. And then we do have a strategic plan, and we make investments according to that strategic plan. Some of those might be equipment, and the VA is formed into regional operating networks. We're part of what's called Network 2. And there are 23 networks nationwide, so New England basically is one network.
And how many VA hospitals are in New England, in that region 2?
Network 2.
Network 2.
Is basically all of New York with the exception of Long Island, the city, and they also have Jersey. So there's 5 of us. And then there's another, I think, 30 of these primary care practices to cover the entire spread.
So who's the regional VA rep?
We have an interim network director. Her name is Darlene Delancey, and their headquarters are right on the ground of the hospital.
In Albany?
In Albany. Actually, prior to becoming the director, I was the deputy network director.
Oh, you were? Oh, okay.
And then transitioned over to senior executive service to run the hospital.
So I asked this of all public officials, what's your salary? Because it's public record, like you say. So.
$166,732 a year.
And 23 cents, no.
I'm not sure about the 23 cents.
I'm joking, okay. So that's good, that's,
Yes,
not a bad salary, but you have a lot of responsibility, and you have to have a salary like that in order to attract, the right, the capabilities that you need to be in your position.
Well, public service is a fabulous reward in and of itself.
Yeah.
I actually make about 1/4 of what other medical center directors do.
Why is that? Not because you're a woman.
It's public service.
Other medical center directors, not in the private sector.
No. Not VA. VA is VA, and it's flat and equal.
Equal all across. So all the VA all the VA hospital directors earn $166,000.
No, well, actually, we have different pay bands. It might be related to the size or complexity of your hospital.
Yeah.
If I chose to go to run West LA, which I think is the biggest hospital in the system, that salary goes up to $181,000.
Right.
But in
you're
terms
comparing yourself to like a Jim Barber at Albany Med.
we won't even do that because the number gets even smaller in terms of comparison. But
he would be your counter, wouldn't he? Would he on the same level as?
Well, Albany Medical Center is an umbrella organization. They have the medical college, They have the medical
Right.
center,
Right.
different complexity than we are.
Okay, do you have an intern program or residency program or anything like that where young, people who can't get into an Albany Med might also be able to want to be in VA? Maybe they are a veteran, maybe after they got out of their service, they want to serve?
Actually, we have 147 different academic affiliations.
Mm-hmm.
Our primary academic affiliation is with the medical center. The interns, medical students, interns, and residents who come to Albany Med rotate through us just like they do through Albany Med.
We have one more minute, and we're on public access, and we have so many viewers. You said there are people who like to, number one, volunteer. I mean, do like say a person saying, hey, these veterans put out their lives and put out their, literally put their lives on their line for us. I have extra time, a lot of people do, and volunteer. Do you take volunteers? What can they do to do some helping the VA?
Well, they could contact Mr. James Keller at 626-5000. If they call the main hospital number, he has to be connected to voluntary service. And we have a variety of opportunities to be part of the medical center and what it does and how it helps veterans.
Well, I want to thank you, Linda, because, even though, like you say, it's a public service, even though you're, a paid employee, but listen, you're doing a lot of good work. I mean, and the country really owes it to the veterans. If not, like I say, I hate to think that, if the Germany would have won World War II, I don't even begin to think about that. And 500,000 Americans put their lives on, literally got killed because to beat our enemies. And we owe a lot to them, and really our whole lives. As a Jewish person, I have totally appreciate it. And you're doing good work, helping them. They put their lives on the line, and you're helping them. So thank you very much for your good work.
Thank you.
Yes, and thank you for being here.
Thank you.